Welcome to Krones WellNest, where wellness meets wisdom and your health takes center stage. If you're on a quest for a healthier, happier you, you're in the right place. But before we dive into the treasure trove of well-being, hit that subscribe button, give us a thumbs up, share the wellness love, and drop a comment below. We thrive on your support. Thanks, loyal viewers, for joining us on this journey. Let's soar to new heights of health together. Hey there, health warriors. Are you ready to embark on a journey to uncover the secrets of early detection and empower yourself in the fight against cancer? Well, get ready, because today's video is all about the importance of early detection, screening tests, diagnosis, and treatment for cancer. We're diving deep into the world of cancer prevention, detection, and treatment to equip you with the knowledge you need to take control of your health. So, buckle up and get ready to learn, because we're about to discover how early detection can save lives. Globally, cancer presents a significant epidemiological challenge, with millions of new cases diagnosed annually and millions more living with the disease. According to recent data from the International Agency for Research on Cancer, there were approximately 19.3 million new cancer cases and 10 million cancer-related deaths worldwide in 2020. These figures illustrate the substantial burden of cancer on public health systems and societies worldwide. Geographically, there are notable disparities in cancer incidence and mortality rates, with variations observed between regions, countries, and even within populations. Factors contributing to these differences include genetics, environmental exposures, lifestyle habits, socioeconomic status, and access to healthcare services. For instance, high-income countries generally report higher overall cancer incidence rates, attributed in part to better diagnostic capabilities and aging populations. Conversely, low- and middle-income countries often face higher mortality rates due to limited access to early detection and treatment services, as well as higher prevalence of risk factors such as infectious agents and tobacco use. Common types of cancer vary across regions, with lung, breast, colorectal, and prostate cancers being among the most frequently diagnosed globally. However, the distribution of cancer types can differ significantly between regions, reflecting differences in risk factors and genetic predispositions. These epidemiological insights underscore the importance of targeted interventions and global collaboration in addressing the burden of cancer, with efforts focused on prevention, early detection, access to quality treatment, and equitable healthcare delivery to reduce the global impact of this disease. Now, let's kick things off by addressing the big question. Why does early detection matter so much when it comes to cancer? Well, imagine this. Catching cancer in its early stages is like spotting a wildfire before it spreads out of control. Early detection gives us the upper hand, allowing for more effective treatment and better outcomes. But don't just take my word for it. Let's delve into the science and uncover why early detection is the key to beating cancer. Early detection of cancer is crucial because it offers several significant advantages in terms of treatment outcomes, prognosis, and overall survival rates. There are several scientific reasons why early detection matters so much in the context of cancer. Number 1. Treatment options. Detecting cancer at an early stage often provides a wider range of treatment options. Early-stage cancers are typically smaller and localized, making them more amenable to surgical removal or less aggressive treatment modalities such as radiation therapy or targeted drug therapies. In contrast, advanced-stage cancers may have spread to other organs or tissues, limiting treatment options and decreasing the likelihood of successful intervention. Number 2. Improved prognosis. Early detection increases the likelihood of successful treatment and improves the overall prognosis for individuals diagnosed with cancer. When cancer is detected at an early stage, before it has had a chance to spread to other parts of the body, the chances of achieving long-term remission or cure are significantly higher. Early-stage cancers are generally associated with better outcomes and higher survival rates compared to cancers diagnosed at later stages. Number 3. Reduced treatment intensity. Early detection may allow for less aggressive and more targeted treatment approaches. For example, smaller tumors may require less extensive surgery or lower doses of chemotherapy or radiation therapy, which can reduce the risk of treatment-related side effects and improve quality of life for patients. Number 4. Lower healthcare costs. Early detection of cancer can result in lower healthcare costs by reducing the need for expensive and intensive treatments associated with advanced stage disease. By identifying cancer at an early stage, healthcare resources can be allocated more efficiently, and the economic burden of cancer on individuals, families, and healthcare systems can be reduced. Number 5. Prevention of complications. Early detection can help prevent or minimize cancer-related complications and adverse effects on overall health. For example, early-stage cancers are less likely to cause significant damage to surrounding tissues or organs, reducing the risk of complications such as organ dysfunction or failure. Number 6. Improved quality of life. Early detection of cancer allows for timely initiation of treatment and supportive care interventions, which can improve the overall quality of life for individuals living with cancer. By addressing symptoms and managing side effects early in the disease course, patients may experience better physical, emotional, and psychosocial well-being throughout their cancer journey. In summary, early detection of cancer is critical because it offers the best chance for successful treatment, improved prognosis, reduced healthcare costs, and enhanced quality of life for individuals diagnosed with the disease. Screening programs and awareness campaigns aimed at promoting early detection play a vital role in reducing the burden of cancer and saving lives. Now that we understand why early detection is crucial, let's talk about screening tests. Screening tests are like the detectives of the medical world. They help us uncover cancer before it shows any symptoms. From mammograms for breast cancer to colonoscopies for colorectal cancer, these tests can detect cancer at its earliest and most treatable stages. But wait, there's more. We'll explore the different types of screening tests and how they can help us stay one step ahead of cancer. Cancer screening tests are medical tests used to detect cancer in individuals who do not have any symptoms. These tests are designed to identify cancer at an early stage when it may be more treatable and have a better prognosis. Several types of cancer screening tests are available, each targeting specific types of cancer. Some common cancer screening tests include: Number 1. Mammography. Mammograms are X-ray images of the breast tissue used to screen for breast cancer. Regular mammograms are recommended for women starting at age 40 or earlier for those with a family history of breast cancer. Number 2. Pap smear. Pap smears involve collecting cells from the cervix to detect abnormalities that may indicate cervical cancer or precancerous changes. Pap smears are typically recommended for women starting at age 21 and repeated every few years depending on age and risk factors. Number 3. Colonoscopy. Colonoscopy is a procedure that allows a doctor to examine the inside of the colon and rectum for abnormalities, such as polyps or tumors. Colonoscopy is used to screen for colorectal cancer and is recommended for individuals starting at age 45 to 50, with follow-up frequency determined by the presence of risk factors and findings. Number 4. Fecal occult blood test or fecal immunochemical test. These tests detect blood in the stool, which may indicate the presence of colorectal cancer or precancerous polyps. FOBT or FIT is typically recommended for individuals starting at age 45 to 50 and repeated at regular intervals. Number 5. Prostate-specific antigen test. The PSA test measures levels of PSA in the blood, which may be elevated in men with prostate cancer. PSA testing is controversial due to the risk of false positives and overdiagnosis, and guidelines vary regarding its use. Number 6. Computed tomography scan. CT scans may be used for lung cancer screening in individuals at high risk, such as current or former smokers. Screening with low-dose CT scans is recommended for individuals aged 50 to 80 with a significant smoking history. Last but not the least, Number 7. Skin examination. Regular skin examinations by a healthcare professional or self-examinations can help detect skin cancers, such as melanoma, at an early stage. It's essential to discuss the benefits, risks, and limitations of cancer screening tests with a healthcare provider to determine the appropriate screening schedule based on individual risk factors, age, and personal preferences. While cancer screening can lead to early detection and improved outcomes, false positive results, overdiagnosis, and potential harms from follow-up testing or treatment are also considerations to be weighed. So, you've had a screening test and it's come back with some concerning results. What happens next? That's where the diagnostic process comes in. Think of it as the investigation phase, where doctors use a variety of tests and procedures to confirm whether cancer is present and determine its type, stage, and extent. We'll uncover the ins and outs of the diagnostic journey and how it guides us towards the most effective treatment plan. The diagnostic process for cancer involves a series of steps aimed at identifying the presence of cancer, determining its type, extent, and characteristics to guide treatment decisions. While the specific diagnostic pathway may vary depending on the type of cancer and individual circumstances, the process typically involves the following key components. Number 1. Medical history and physical examination. The diagnostic process often begins with a thorough medical history review and physical examination by a healthcare provider. This includes discussing symptoms, risk factors, family history of cancer, and other relevant medical information. Number 2. Diagnostic tests and imaging. Diagnostic tests and imaging studies are performed to detect abnormalities suggestive of cancer and to visualize the location, size, and extent of the tumor. Common imaging modalities include X-rays, computed tomography scans, magnetic resonance imaging, positron emission tomography scans, ultrasound. Number 3. Biopsy. If imaging studies indicate the presence of a suspicious lesion or tumor, a biopsy is typically performed to obtain a tissue sample for laboratory analysis. Different types of biopsies may be used, including fine needle aspiration, core needle biopsy, surgical biopsy. The biopsy sample is examined by a pathologist under a microscope to determine whether cancer cells are present, characterize the type of cancer, and assess various biological features of the tumor. Number 4. Laboratory tests. Laboratory tests may be performed on biopsy specimens or blood samples to further characterize the cancer and guide treatment decisions. These tests may include immunohistochemistry, IHC, molecular testing, tumor marker tests. Number 5. Staging. Once a cancer diagnosis is confirmed, staging is performed to determine the extent of the cancer spread throughout the body. Staging helps guide treatment decisions and provides prognostic information. Staging may involve additional imaging studies, such as CT scans, PET scans, or bone scans, as well as clinical evaluation of lymph nodes and distant metastases. Number 6. Multidisciplinary review. Treatment planning often involves a multidisciplinary team of healthcare professionals, including oncologists, surgeons, radiation oncologists, pathologists, radiologists, and other specialists. The team reviews all available diagnostic information to develop an individualized treatment plan tailored to the patient's specific cancer type, stage, and overall health status. Last but not the least. Number 7. Treatment initiation. Following the completion of the diagnostic evaluation and treatment planning process, treatment is initiated based on the agreed-upon treatment plan. Treatment modalities may include surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, or a combination of these approaches. Throughout the diagnostic process, communication between healthcare providers and patients is essential to ensure that patients understand their diagnosis, treatment options, potential risks, and expected outcomes. Additionally, ongoing monitoring and follow-up evaluations are typically conducted to assess treatment response, monitor for recurrence, and address any ongoing supportive care needs. And now, onto the final piece of the puzzle, treatment options. Thanks to incredible advances in medical science, we now have a multitude of treatment options available for cancer. From surgery and chemotherapy to radiation therapy and immunotherapy, These treatments are like the superheroes fighting against cancer cells. We'll explore the latest innovations in cancer treatment and how they're changing the game for patients around the world. Cutting-edge treatment options for cancer encompass a range of innovative approaches aimed at improving outcomes, reducing side effects, and personalizing therapy based on individual characteristics of the tumor and the patient. Some of the most promising cutting-edge treatments include: Number 1. Immunotherapy. Immunotherapy harnesses the body's immune system to target and destroy cancer cells. Checkpoint inhibitors, such as drugs targeting PD-1, PD-L1, and CTLA-4, have shown remarkable success in treating various cancers, including melanoma, lung cancer, and bladder cancer. CAR T-cell therapy involves genetically engineering a patient's T cells to recognize and attack cancer cells, showing significant efficacy in certain types of blood cancers, such as leukemia and lymphoma. Number 2. Precision medicine, also known as personalized medicine, involves tailoring treatment strategies based on the genetic makeup of a patient's tumor. Next-generation sequencing technologies allow for comprehensive genomic profiling of tumors, identifying specific mutations or alterations that can be targeted with molecularly targeted therapies. These targeted therapies can include small molecule inhibitors or monoclonal antibodies that disrupt specific pathways driving cancer growth, such as EGFR inhibitors for lung cancer or BRAF inhibitors for melanoma. Number 3. Monoclonal antibodies. Monoclonal antibodies are laboratory-made proteins that target specific proteins on cancer cells, marking them for destruction by the immune system or interfering with their growth and survival. Examples of monoclonal antibodies used in cancer immunotherapy include trastuzumab for HER2-positive breast cancer, rituximab for B-cell lymphomas, and ipilimumab for advanced melanoma. Number 4. Cancer vaccines. Cancer vaccines stimulate the immune system to recognize and attack cancer cells by targeting specific tumor-associated antigens. Therapeutic cancer vaccines aim to boost the body's immune response against cancer cells, leading to improved survival outcomes. Examples of cancer vaccines include Sipuleucel T for advanced prostate cancer and the human papillomavirus vaccine for preventing HPV-related cancers, such as cervical cancer. Number 5. Immune checkpoint modulators. Immune checkpoint modulators are small molecules that target other immune checkpoint proteins, such as LAG-3, TIM-3, and TIGIT, to enhance the immune response against cancer cells. These agents are currently under investigation in clinical trials for various cancer types. And there you have it, Health Warriors, a comprehensive guide to the importance of early detection and the journey from screening tests to diagnosis and treatment. Armed with this knowledge, you have the power to take control of your health and protect yourself against cancer. Remember, early detection saves lives, so don't hesitate to schedule those screening tests and stay vigilant about your health. Until next time, stay strong and keep fighting the good fight. If you found these videos helpful, make sure to adopt the healthy habits into your lifestyle. Share this video with friends and family to spread the knowledge, and hit that subscribe button for more health insights. Your support means the world to us. Stay healthy, stay hydrated, and until next time, take care. Thanks for watching. Subscribe, and see you in the next video.